Dr. Henry, thank you so much for talking with me. One of the things I heard today that we heard for the first time that there has been in-school transmission. This strikes fear into parents' hearts. So maybe you could talk a little bit more about why it doesn't sound like this is alarming to you like it is to many parents.
Yeah, so we know that what's happening in our schools reflects what's happening in our community. And there have been some children who've come into school when they've been early on or had mild symptoms and not recognized it. As soon as it's recognized, public health is there to work to find out if anybody else is sick. And in a couple of situations that I'm aware of, one or two other people may have been sick in the classroom as well and tested positive. And it's sometimes hard to tell whether it was because it was an exposure to somebody else in the classroom or whether it was an exposure outside the classroom. We also know that there's been students who've been hanging out together outside of school, and there's been transmission in those groups of people too. So it's sometimes very challenging to figure out, but what's really important is that we've had no cases in BC of what we call outbreaks, where there's been transmission that's been going on between people that aren't linked, that we don't know. So every time we have a case, public health teams are working with the school, working with the individual, working with the classroom to make sure that anybody who is exposed is now taken out of the school environment and is being monitored. And yes, some of them have developed the illness because once you're exposed, we have no way of preventing you from getting sick. But there's been no ongoing transmission in the schools. So that's the system working.
One of the concerns that some parents have is that they felt like they knew before now. They knew a week ago. They said there was transmission because they saw the cases. And, communication, and you mentioned that today, communication has had some challenges. And I think part of it is expectation of what parents thought and teachers and staff thought they were going to hear and what they're hearing now. And one of the things I think that I'm hearing that people thought they were going to hear is if there's a transmission, we're going to hear about it right away. So some people are feeling like they're not getting all the information and that's making them feel uncertain. So why are people not being told right away when public health has determined that there is a transmission between students in a class?
Yeah, so what we're telling people is actually the step before that. If there's been any person who's been in a school setting during their infectious period, so in the time when they could potentially pass it on to anybody else, and all of those, and when we know that, we tell the school community. And there was some glitches in how we were going to do that. And it really is us trying to make sure we have that balance of transparency, of putting things out there, making sure that parents are aware that we're there and we're working on it for every single one of these cases and that we're managing them. Where we have had some challenges is when people think they know who it is and there's rumors, and we've had some unfortunate events where children have been harassed or there's been nasty messages. And so we try very hard to find that balance of getting enough information so that people are aware that we're working with schools, that we know what's going on, and that if they've not had that direct call from public health that tells them they're at risk, that they're okay. And managing that with making sure that we're protecting people from sometimes bad behavior, unfortunately.
And talking about those calls from public health, some people are wondering, like, why am I told to do this when I hear from public health that my child is supposed to isolate, but the rest of us are okay? And other people are told different things, and they feel like there's different rules for everyone, and that is creating also uncertainty.
Yeah, so it depends on the risk that an individual has. So if your child was in a classroom and there was somebody in that classroom, whether it was a teacher or another student who was infectious in there, it may be that they were only sitting in the other side of the room. They didn't have any other contact. The person might have been there for a very short period of time with a mask on. It depends on the individual situation. So in that sort of a situation, most of the children who were in that class would have been told to just monitor for symptoms like you do everywhere else. There's an exposure event, but it's, there's not a risk of you getting sick, not a much of a risk. For those who have had close contact, so face-to-face contact that we know is risky, whether it's in the classroom or in other settings that we know. Often what we're seeing is that people are, particularly older children, they're hanging out with people outside of the school, and that's where most of the risk is. So if I'm had a close contact, then you'll be getting a call from public health, and they'll ask you to keep the child home, or the teacher to stay at home and to monitor for symptoms from 14 days from that contact. But your family, you're not sick. You're not somebody who's at risk for your family. So they are a contact of a contact. And does get confusing. And this is why we say, this is the work that public health does, and they'll be able to explain everybody's individual situation to them.
Is there any way to have some kind of a flow chart to say, and not just for when you've had a contact, but you've heard a lot of these questions about the changes in the checklist for students going to school, and I know we've even come across it. It's like, their nose is a little bit runny, but they don't have a fever. Like, is there no way to have sort of, you said today that people need to rely on knowing their children, but can we not have a checklist saying, if this happens, this is what you need to do? If your child is this age and you're with them this much and they are if they're around someone, this is what they need to do. If they have a runny nose, this is what you need to do. Can't we have something like that?
Yeah, that's a really good point. And we have had, we've been working on those. In public health, I think sometimes we think everybody understands what we're saying, and it's become very clear that we need some things that are very, very simple that can help guide people. And we are working on those and expect to have those out. And we've been, my team has been working with the Ministry of Education so that everybody's on the same page about these flowcharts. The challenge is they've been developed by us clinical people, so we need to put them in a language that more people understand. And I absolutely have been looking at how do we do a checklist, and in the Yukon they have a stoplight sort of thing. So red is, your kid has a fever and a cough, and that's, stay home, get tested. Green is they're fine, they can go to school, and yellow is those ones that, think about it. Think about your situation. Is anybody else in the family sick? Is this usual for your child? And maybe keep them home for 24 hours. So yes, we are working on something that will be more helpful to parents.
You mentioned like the medical speak. Do you think that that's part of what the challenge has been between parents and some lack of confidence that's happened with this school? And of course, it's heightened anxiety with kids going to school. But do you think that that's a lot of what's happened, is saying in a way that people understand? And sometimes people feel patronized that they're hearing, don't you worry, we know what you're doing. And people are like, I'm worried, it's my child.
Yeah, I know, and I get that. It's a difficult balance, and we've been learning so much about COVID, and I think we understand, what the risk is, but we all want zero risk, and that's not a reality right now. We know there's still some of this virus is circulating in our community, and schools are a reflection of that. So there is going to be some cases. So we've been trying to help people understand that this is okay. We know this is going to happen. We're also very reassured that younger people are underrepresented, don't get sick, don't get infected as much, and don't get very ill, which is really good. Obviously, we want to do everything we can to make sure they're not bringing it home to their families, and that there's, but yeah, we need to be able to communicate that better, and we're learning as we go. Things that we thought would work and resonate, it's come across differently, and so we need to recharge, we need to redo, make sure our messages are clearer.
With teachers, they hold a lot of very personal and intimate information about students. Why are they not included as part of the contact tracing? Many saying that they know things that the students are doing that the kids may not tell you, that they may be able to assist with contact tracing.
Yeah, I can say that teachers are absolutely involved, depending on the situation. And so it will depend, where the person was exposed, what sort of things are going on, what age of the classroom. So teachers are definitely involved, and the local school health officer and the school health teams from the health authorities do talk to the principals and the teachers.
But why not in all situations? Like, why wouldn't they just automatically be introduced and a part of this as soon as there's a case in their class or their cohort?
I think we have to recognize that there's been very few. So if we think about the almost 2,000 schools that we have, the number of introductions or even mild exposure events have been very small. And so the circumstances of them, given that we've only been back in schools for a few weeks, most of these, almost all of them, have been from exposures in the community. So we have a pretty good idea of where people have been exposed. And for most of them, the exposure period of time in the school is very short. So it depends on the situation, and it depends on the age and what the child's been doing and how understanding or the story that we get from the family and the child. So absolutely, teachers are important partners in this. I will also say that many of the exposure events have been teachers or other staff who work in the schools. And in those cases, of course, we wouldn't go to other teachers to get information.
Do you have a percentage of how many of the cases so far have been students and how many have been staff or teachers?
I don't have that today. I did have it at the beginning. It's the majority has been teachers, or I shouldn't say teachers, have been staff, not only teachers.
When you're looking at this point, I mean, it's 3 weeks in. Is it going better, worse, or about the same as what you expected when you laid out the plan?
You know what? I think it's going really, really well. I've been so impressed. We have over 500,000 kids who are back in school, and they need this. There's been glitches, of course, not everything is perfect, but I have been so impressed by teachers, by the support staff, the custodial staff, by the bus drivers, by the whole system, and the imagination and the great ways that they're helping kids adapt. And I'm also really struck by how resilient and adaptable young people are.
Rapid tests. We've heard that we're getting some federally. How are they going to be prioritized? Might those be used in schools, or is it going to go to long-term care?
Neither. I think mostly right now we're looking at that testing platform and the Avid ID, it's called Avid ID now, will be really most important in our more remote communities where it's challenging to get access to a test. In most of our more urban areas, we're working on making sure we can speed up that process, but the access to a test is much easier. So these initially will be deployed to more remote, some of our First Nations communities where access to testing is a real challenge.
With schools, is there any chance we're going to see some sort of, I know you talked about like testing the water way back at the beginning, that we would have like a group class, like spit in a cup and do that kind of testing, that kind of group pool, I guess, as it were?
I hadn't really thought about that. What we do know from across the country is that asymptomatic testing, so just testing groups of people like healthcare workers or people without any symptoms with no risk factors that we know of, has a very low yield. So we get very few people that are positive. And in Alberta, they had some stats that showed over 50,000 healthcare workers were just tested randomly without any symptoms, and less than half of 1% were positive. So it's kind of a waste of scarce resources at the moment, I would say. But once we have some newer tests, some of the antibody tests perhaps or some of the rapid tests that are like a little ticket test, if we have lots of those, the sensitivity, so their ability to actually pick up the virus is less. But those are scenarios where we could use them in school settings, in long-term care settings, in places where we think we might have something, but we're not sure, and we can do testing of lots of people really quickly.
I know you need to run. One last thing. So for the parents and some teachers out there who I've heard from over the last few weeks who feel that they haven't been told the whole truth, sometimes they feel that they're being lied to, or that they're not being told the whole truth because it's beneficial, or that that the public health is trying to keep mum on things like transmissions. So what do you say to the parents and teachers and staff out there who feel like they haven't been told the whole truth, or they feel like they're still not being told the whole truth? What do you say to them about what they're hearing and what they're feeling?
I understand that mixed messages are very disconcerting. We know that there's lots of messages that fly around on social media, and not all of them are true. And it's very challenging for us we can't give specific comments about specific people because it's so important for us to be able to maintain that trust for people. What I can say is that, yeah, we had some communication glitches and we're working on those. And we are going to be very upfront, and we are now. Any exposure event will be posted. The dates of the exposure will be posted. And public health is working with every single school in this province. And we're managing these with you in partnership. And we will get through this together.
And just one clarification. So with outbreaks and clusters, are we going to hear about those, or only if they get out of control? When are we going to hear about those?
Yeah, so those will be posted as well when they've been declared, yes.
What I'm wondering is there one was declared, like you're saying today, that there is a cluster, but I haven't seen that anywhere, or has it just not been posted yet?
Sorry, exposure events and outbreaks are the ones that so some of the exposure events lead to limited transmission. That wouldn't be posted. And so, yeah, I just want people to understand what we're talking about when we're saying a cluster is, maybe more than one case, but it's not an outbreak. So we will absolutely be posting if there is an outbreak. But we'll also be notifying individuals who are at risk, and we're making sure that the school community knows first.